Guys, low back pain is so prevalent in our society. The number one cause of disability. Over 80% of people suffer from low back on a daily basis. So I want to talk to you a little bit about low back pain and especially disc injuries today. I think everyone's heard about a herniated disc or a slip disc or even a prolapsed disc, but there's all sorts of problems that happen in the low back that are extremely serious. And I want to touch on those today and the most common ones we see here at the office. And then we're going to shoot a few videos on how to start taking pressure off your low back and off those discs to get you healthy and mobile with conservative management of your spinal issues. So the number one thing we tend to see in disc injuries is a bulging disc or a herniated disc. And for those of you who know what the spine looks like, it looks like this. And the discs are these big cushions between the vertebrae. So the vertebrae are these white bones and the discs sit like this. Now what'll happen to discs? Either in an acute injury like a car accident or sometimes just chronic, from sitting for a long time or lifting the wrong way, you can herniate a disc. So you can actually damage the tissue that sits here cushioning these bones. Now, these discs tend to injure themselves by rupturing or pushing backwards. And you know what? The spinal cord sits right behind those discs, and that's why these injuries can be devastating. When you have a herniated disc, typically it moves backwards and it starts pressing on the nerves. Okay? So the number one thing we have to understand about the low back is, there are normals we want to see to keep those discs healthy, but if someone has already sustained a disc injury and they're getting pressure on nerves, it can be everything from low back pain. People can keep antalgic, they're going to lean to one side to try and keep out of pain. But what you have to understand about these nerves is they're doing a couple of really important things. Number one is they're going down to your legs. So the first thing is you can get a lot of leg problems, including sciatic pain and even loss of your foot function with a disc injury. Okay. The second thing is these nerves are also going to your bowel, bladder, your reproductive, your sexual organs. So taking these nerves and applying pressure from an injured disc can be a real health risk, like a real long-term problem. That's why keeping your spine healthy is such a priority in this office. So what we're going to do is show you a few exercises at the end of this that are going to start taking pressure off those injured discs. Okay. Now, I'm assuming that if you're watching this, you want to learn a little more about keeping healthy and how back injuries can be managed conservatively. If you are suffering from a serious disc injury, of course, consult a professional before you try any exercises at home. But I'm going to show you the most commonly prescribed exercises by chiropractors and physiotherapists and even physicians to start taking pressure off those discs, taking pressure off those nerves. And what we know about discs is the vast majority of them are going to heal in a conservative manner with no surgery if we do the right conservative care. So stay tuned. We're going to hit the floor next and give you some rehab exercises to take pressure off your low back.